Nicole's an active, healthy living mom who wanted to change. But she didn't want to be judged by her friends or her community. Hear her story. See her results. Her breasts, her body, her turn. Hey Nicole, thanks for meeting me here.
Yeah, no problem. I have some time before my spin class. I hope you don't mind. I have to drop off my son at Taekwondo.
Oh, of course not. Hey there, buddy. Okay, so I'm gonna ask you about 20 or so questions. Is that cool?
Yeah, let's do this.
So, how many kids do you have?
Oh, just the one little ninja here.
And how old is he?
I'm 5 years old. Yeah!
He's my little man.
So, what's the biggest surprise about being a mom?
Gosh, how tired you always are and how much hard work it is. I mean, you really don't get a break.
And what's the best part about being a mom?
Well, I guess watching him turn into his own little person, it's pretty miraculous. All right, you go inside and I'll get you after, okay?
Okay, so we're gonna get a little personal now. Is that cool?
Totally cool.
What's your favorite body part?
I guess it would be my legs. I've always been pretty athletic.
And your least favorite?
Well, after pregnancy, it was my breasts.
Why your breasts?
Well, before pregnancy, they were really proportionate to my body, and then after, I went from a small B to a 38G. I didn't even know G was a size.
So what happened after you had the baby?
Well, my breasts were really saggy and kind of floppy. I mean, they just seemed kind of sad, but they'd been through a lot, so they just didn't match the rest of my body anymore.
How did pregnancy affect your tummy?
There was some excess skin, but I was lucky I didn't have any stretch marks.
Sounds like you being active and athletic really helped.
That and some good genes.
What did you think about moms who had their breasts or tummy done after kids?
You know, I think that moms go through so much and sacrifice so much of their own bodies that if they want to do a little here and there, that's great.
What made you finally decide to get a breast augmentation?
I was just tired of my body not being in proportion and not being able to wear a bra that actually fit.
How did you decide on your surgeon?
His professionalism, he's board certified, and he really listened and understood my needs.
So what did you and your surgeon decide to have done?
We wanted a look that was not overdone, and so he and I chose the Natrelle Breast Implants.
Anything else? Your tummy?
I was okay with the way my tummy looked.
Did you add on any facial treatments?
I did get a facial injection right here for my frown line.
Did you share your decision with anyone?
Of course, I told my husband, my sister, and a few friends.
What was their reaction?
My husband said, do whatever makes you happy, and so did my sister.
And your friends?
My friends were so excited, and now they all want to get breast implants.
So Nicole, how did you manage after your surgery?
Well, my husband was home from my recovery, and my son's older, so that helped. It was the right time for me.
What would you say was the most difficult thing about your recovery?
Not being able to be active, like going running on the beach, or taking a spin class, or teaching Pilates.
Oh, I bet that was tough. I gotta know, what is the first thing that you did after your breast augmentation?
I went to the store and I bought a bra that fits.
What's one of the things that you love most about this new change?
Being able to wear a sports bra that actually fits and makes me feel good.
What would you say is the biggest misconception that you had about seeing a plastic surgeon?
That the surgeon would push his idea of what my breast should look like, but luckily for me, that didn't happen.
That's great. Is there anything that you would say to other moms that are out there debating something like this?
Just that we all do so much for our families and we go through so much after childbirth that it's okay to do something for yourself.
That's great. Anything else that you would add?
That it's okay to make it your turn.
All right, people, let's get started.
Gotta go.
Moms, make it your turn today. Talk to a plastic surgeon and see what's right for you. You can also visit our website, itsmyturn.com, to learn about your breasts, your body, your turn. And be sure to use hashtag #MyTurn in your pictures on Facebook, Instagram, and Twitter when you share your new look.
Botox Cosmetic, onabotulinum toxin A, important information, approved uses. Botox Cosmetic is a prescription medicine that is injected into muscles and used to temporarily improve the look of both moderate to severe crow's feet lines and frown lines between the eyebrows in adults. Important safety information. Botox Cosmetic may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks after injection of Botox Cosmetic. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms including loss of strength and all-over muscle weakness, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. Botox cosmetic dosing units are not the same as or comparable to any other botulinum toxin product. There has not been a confirmed serious case of spread of toxin effect when Botox cosmetic has been used at the recommended dose to treat frown lines, crow's feet lines, or both at the same time. Botox cosmetic may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox cosmetic. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you are wheezing or have asthma symptoms, or if you become dizzy or faint. Do not take Botox cosmetic if you are allergic to any of the ingredients in Botox cosmetic. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin products such as Myablock, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A. Have a skin infection at the planned injection site. Tell your doctor about all your muscle or nerve conditions such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects including difficulty swallowing and difficulty breathing from typical doses of Botox cosmetic. Tell your doctor about all your medical conditions including plans to have surgery, had surgery on your face, weakness of forehead muscles, trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox cosmetic can harm your unborn baby. Are breastfeeding or plan to. It is not known if Botox cosmetic passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Botox cosmetic with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox cosmetic in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myablock, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received. Have recently received an antibiotic by injection. Take muscle relaxants. Take an allergy or cold medicine. Take a sleep medicine. Take aspirin-like products or blood thinners. Other side effects of Botox cosmetic include discomfort or pain at the injection site, headache, and eye problems, double vision, blurred vision, drooping eyelids, and swelling of your eyelids. For more information, refer to the medication guide or talk with your doctor. To report a side effect, please call Allergan at 1-800-433-8871. Please see Botox Cosmetic full product information including boxed warning and medication guide at BotoxCosmetic.com. Natrelle silicone-filled breast implants. Important information. Who may get breast implants? Indications. Natrelle silicone-filled, Natrelle Inspira, and Natrelle 410 shaped gel breast implants are approved for women for the following: breast augmentation for women at least 22 years old for silicone-filled implants. Breast augmentation includes primary breast augmentation to increase breast size, as well as revision surgery to correct or improve the result of a primary breast augmentation surgery. Important safety information. Who should not get breast implants? Contraindications. Women with active infection anywhere in their body. Women with existing cancer or pre-cancer of their breast who have not received adequate treatment for those conditions. Women who are currently pregnant or nursing. What else should I consider? Warnings. Breast implants are not lifetime devices and not necessarily a one-time surgery. Many of the changes to your breasts following implantation cannot be undone. If you later choose to have your implants removed and not replaced, you may experience unacceptable dimpling, puckering, wrinkling, or other cosmetic changes of the breast, which may be permanent. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent and may not be detected by you or your doctor. You should have an MRI 3 years after your surgery and then every 2 years after that, for as long as you have your breast implants to determine if rupture is present. If implant rupture is noted on an MRI, you should have the implant removed with or without replacement. With breast implants, a routine screening mammography and self-examinations for breast cancer will be more difficult. Ask your doctor to help you distinguish the implant from your breast tissue. Symptoms of a ruptured implant may be hard knots or lumps surrounding the implant or in the armpit, change or loss of size or shape of the breast or implant, pain, tingling, swelling, numbness, burning or hardening. Tell your doctor of these symptoms and remove ruptured implants. Inform any other doctor who treats you of the presence of your implants to minimize the risk of damage to the implants. What types of conditions require more study? Precautions. Caution. Notify your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, for example, lupus and scleroderma. A weakened immune system, for example, currently taking drugs that weaken the body's natural resistance to disease. Planned chemotherapy following breast implant placement. Planned radiation therapy to the breast following breast implant placement. Conditions that interfere with wound healing and blood clotting. Reduced blood supply to breast tissue. Clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Please discuss any history of mental health disorders with your surgeon prior to surgery. Patients with a diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What are some complications with breast implants? Complications. Key complications are reoperation, implant removal with or without replacement, implant rupture, and severe capsular contracture, severe scar tissue around the implant. Other complications include asymmetry, nipple, breast, skin sensation changes, scarring or wrinkling, rippling. Talk to your doctor about other complications. Talk to your doctor. For more information, see the patient brochures at www.allergan.com/labeling/usa.htm or call the Allergan Product Support Line at 1-800-433-8871. To report a problem with Natrelle silicone-filled, Natrelle Inspira, and Natrelle 410 shaped gel breast implants, please call Allergan Product Surveillance at 1-800-624-4261. Natrelle silicone-filled, Natrelle Inspira, and Natrelle 410 shaped gel breast implants are available by prescription only.